Bismillahirrahmanirrahim. Assalamu alaikum. Today we are going to discuss the electrodiagnostics. In the electrodiagnostics, we are going to perform two basic tests, the Rheobase and the Chronaxie. First of all, we need to go to the diagnostic menu and then we need to go for the new session and we need to select the channel 1. Right now we are using channel 1, so channel 1. And the first thing is Rheobase and Chronaxie. So we are going to click the Rheobase and Chronaxie. Here you can see that if we choose the Rheobase, it is being set at 500 milliseconds and the Chronaxie value is not known. So first we need to find out the Rheobase and then we need to find out the Chronaxie. So what is the concept is that the minimum amount of current that is required to elicit a visible muscle contraction is called the Rheobase. Okay, so the setup is this, that I have placed two electrodes onto the flexor aspect of the subject, and the patient is connected with channel 1 to the unit, and now I'll select this Rheobase over here and gradually I'll try to increase the intensity. So at 0.1 milliampere we can see there is no visible contraction, and we have done this test before, so we'll increase the intensity to about 10 right now, and let's say here we can see that there is, after 500 millisecond, there is the visible contraction. So once we get the desired contraction which is visible, then you need to select that this is the value for the Rheobase, and we have entered it as the Rheobase. Now we need to find the Chronaxie. The Chronaxie is basically the minimum amount of time or the pulse width required to elicit a muscle contraction. So we are going to select the Chronaxie function right now. We'll click this, and here you can see it is starting from the 50 microsecond or millisecond. So if there is a contraction, we will just say that okay, yes, there is contraction, but right now there is no contraction, and you can see this point over here. So we are going to increase it at 200. There is a visible contraction, you can see, and now I need to set it that okay, this is the Chronaxie. So these are the values of Rheobase and the Chronaxie. What we need to do is we need to join these points like this. So we need to draw a line from top to meet this point, and from this point to this point. So this is the normal value of the Rheobase. If the person is denervated or if the person has problem in the neuromuscular junction, this curve will be shifted towards the right. So it will be on the topmost aspect. So sorry for the camera. Let me say it again. So the curve is that in a normal person, the curve is on the left hand side. It's just like this. But if the person is denervated, this curve will be shifted towards the right on top. So this shows that the person is denervated, and if it is on to the left side, it shows that the person is innervated. That's how you perform Rheobase and Chronaxie, and these are the basically intensities and pulse widths required to elicit muscle contractions and to effectively apply electric stimulation to any muscles. Thank you very much.